Oh, the mayor. Hey, Mayor. All righty. Good afternoon, everybody. We're going to begin our press conference. My name is Peter Zanoni. I'm city manager for the city of Corpus Christi. And this is our daily briefing on COVID-19. I'll be speaking first, providing an update to the community on number of new cases, number of deaths, any change in the hospital status of patients, and talking to you a little bit about testing locations and testing events that are coming up. And then Annette Rodriguez, our public health director, will join us through WebEx, providing us an update and some of her perspective on what's going on and how to stay safe in the community. With us here today is Nueces County Judge Barbara Canales. She'll be speaking as well, and then Mayor Joe McComb is here and he'll speak as well this afternoon. Okay, so we first want to thank the viewers who are watching. We know that you all watch on Facebook and YouTube, the city's channel. We especially appreciate the media coverage that's here today and that has consistently been here, providing the community with up-to-date access on what we're reporting. So thanks to both parties, the persons watching, but the persons reporting it out as well. Okay, so for today, we had an all-time high of number of new cases at 362 back in July 1, but today we're exceeding that by 7%. So we have an all-time high case now of 388 new cases announced for today. And as I mentioned, that's 7% higher than the 362. It follows yesterday's 288. We had a 300 back in 7-4, 362 and 7-1. So Annette will talk to us more about this, but our numbers definitely are not going in the right direction, and this is really concerning. So 388 new cases for today. Some of these come from our drive-through testing that we did today. We had mentioned that we had to do a pause on some of our testing because of supply issues, but we have received some additional supplies, not enough to do the massive numbers we need to do in testing. But we did receive some supplies, so we did a drive-through test today. We had 200 persons scheduled, but 112 showed up. And we had about a 30% positive rate on that number. I'll go over some of the other testing sites that are taking place as well. Our test sites, when we do them, the City County Health District, we can get the swabs of the samples analyzed quickly. So these numbers include all of the test site results from today. Somebody asked yesterday, and we haven't been talking about it as much, but to date, the number of tests that we have done in the community is over 22,000, right? So remember that number used to be pretty low. It was in the hundreds back in the early part of this pandemic, but to date, given all sources of testing, whether the City County Health District did it, a hospital, a commercial lab, the National Guard of the state of Texas, we've done 22,106 tests in the community. Okay, so let's look at the donut chart here. This shows, puts into perspective those that still have the case of COVID-19 versus those recovered. And we've been at about an 88% active rate. Today it moves up to 90% given a large number of new cases. So 90% of those persons that have COVID still do have it. They're not completely recovered or out of that status. So just under 4,000 total cases, 3,996 to be exact. We do have on this chart, you'll see we put it in the yellow slice, 27 deaths. That's something I'm going to talk a little bit more about because that's a new statistic as well for us today. We had 8 additional deaths, and that's an all-time high for one day for our county. So that number is increasing to that 27. Okay, then the number of persons hospitalizing is increasing slightly from yesterday. Yesterday we had just under 270 in the hospital. Today that number is 285 in the hospital. You can see an upward trajectory of persons hospitalized. The persons in ICU on the next chart remains somewhat stable. There's 88 persons in ICU. We'll see on the next graphic here. There we go. So 88 people in ICU across Nueces County. And that was the same number as yesterday and up from the 80 number from July 5th. Okay, now the number of deaths is something we've been reporting throughout the day today as best we can. You can imagine the hospitals extremely inundated. Our city county health district staff are extremely inundated helping those that need help and getting them information and direction. So we're trying to get out as fast as we can when a death occurs. At first, at least we're announcing a death, and then as the staff has time and the hospitals provide the information, we'll be releasing information to include, was it a male, female, what was the age, and did they have any comorbidities or not. So yesterday in our press briefing, we reported 18 when we were here yesterday around the same time. But later on in the evening, there was an additional death. So for yesterday, our death total was 19, right? We had reported 18 at 5-ish. But by the end of the day, by midnight, it had risen by 1 for a total of 19. Today, since around 8 a.m. this morning, we've announced 8 additional deaths just in the past 8 hours, right? So that brings our total to 27 deaths over here. You can see the story here is that in the first 3 months, we only had 3 deaths in total in Nueces County. So approximately 1 death a month. It didn't really happen that way, but 3 months resulted in a total of 3 deaths. But since June 9th or so, June 16th, our death total has been going up, and it especially climbed today with the 8 additional deaths since this morning. Okay, and then we're still doing our averaging just to kind of see things more from a long-term perspective. So this shows the number of tests taken by day with the lines here. And you can see we had a big increase last week, but that's when we had a lot of supplies and availability. We're kind of rebounding a little bit over here as our supplies come in from the state request line that we use. Our average daily tests, on a 7-day average, we're doing about 500 tests a day, 491 to be exact, tests per day for the past 7 days when you look at the daily average. Okay, and the number of COVID cases too from a long-term perspective. This takes it out all the way out from the beginning when we started tracking on April 7th. But you can see it was real low. We had a little increase there. That was the breakouts that we had at the meat processing plant and some of our senior facilities. But you can see what's been going on here since kind of the beginning of June and July. And so that's where we're at. The average daily number of cases on a 7-day average is 297. So about 300 cases a day. To put that in perspective, we used to have about 3 cases a day, right? So it's 300 a day now. Okay, now on testing availability and location, the City County Health District, we've been at various locations over time, and we're kind of gravitating now towards the Health District's headquarters. That's on Horn Road, so 1702 Horn Road. That's where the City County Health District complex is, and we're going to probably use that site for the near future to test about 200 people a day. We think that's the amount of supplies for the next couple of weeks, maybe next couple of 1 to 2 weeks. The amount of supplies we have, that's probably a conducive test number, about 200 a day at our facility. And we're going to use that Horn Road, 1702 Horn Road location, our health department. And that could move just across kind of the grass to the Greenwood Senior Center. We're working to see if we can free up that building because it does have a covered drive-through. But those tests will take place every Tuesday, Wednesday, and Thursday from 6:30 until completed. But the amount of reservations are already booked for the foreseeable next couple of events. And so persons will be called through the reverse alert system that we've been using. And so if people need to get tested, they can call still the health district, but the test won't be administered this week and maybe not even next week because of the backlog that we have. But we'll be doing about 200 tomorrow and then 200 on Thursday, and then that will repeat next week as well. The county with Nueces County Judge Barbara Canales and private lab, as well as Spahn staff, Spahn Hospital, are continuing to test at the former Memorial Hospital drive-through, and so they are helping to address some of those 1,000 to 3,000 persons that want to get tested, and the judge will probably speak a little bit about that when she comes out. And then yesterday, and it probably doesn't hurt to repeat it today, if I can find it here, there's alternate test sites that are still open and still accepting persons by appointment only. You have to call, though. Some of them are free, some of them cost. So the free testing sites for this week include those that are being conducted by the National Guard. And all of the National Guards are by appointment only. And there's 3 coming up beginning Thursday, July 9th. There's one on July 9th, that's at the Borchard Fairgrounds from 9 to 1. And then on Friday the 10th, there'll be one at the American Bank Center from 9 to 1. This is again through the National Guard. And then on Saturday, back at the Borchard Fairgrounds from 9 to 1, there'll be another event there, Saturday, July 11. So those 3 are being conducted by the National Guard and by appointment only. And the number to call if you're trying to get an appointment through that setup is 512-883-2400, 2400. 512-883-2400. Okay, then there's a few providers that have been helping out the area providers. That includes Amistad Community Health Center. They're continuing to be a test collection site Monday through Friday by appointment only. And they can be reached at our area code 361-884-2242. And then the Coastal Bend Wellness Foundation is another provider, and also by appointment only, Monday through Friday, 361-356-9572 is the number to call for them. CVS Pharmacy recently announced they are a test collection site, and they'll be testing daily by appointment only. And the location's on South Alameda, and they can be reached at 361-814-8305. And then finally, actually there's 2 others. Physicians Premier ER is a testing site by appointment only. I don't have that telephone number, but you can probably find it, Physicians Premier ER. And then Christus Promptu Urgent Care is another one at any location. Same thing with Physicians Premier at any location. And those are by appointment only, okay? You can call our health district number for additional information and testing with us as well. Okay, so that concludes kind of a statistical update for today. We're going to have Annette come up here after we have a translation into Spanish from Gabby. And then following Annette, we'll have Nueces County Judge Barbara Canales and Mayor Joe McComb, both of whom were with us today. Thank you.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 388 casos confirmados por el coronavirus, haciendo un total de 4,472 casos. 449 de los 4,472 se han recuperado por completo. 285 personas continúan en el hospital. De esas, 88 están en la unidad de cuidados intensivos. 3,996 casos continúan activos. Hasta la fecha se han realizado más de 22,000 pruebas por parte de la Guardia Nacional, así como del Distrito de Salud y laboratorios privados, así como hospitales. El día de ayer le reportamos durante la conferencia de 18 fallecimientos. En la noche hubo un fallecimiento adicional, pero en las últimas horas se reportan 8 fallecimientos, haciendo un total de 27 personas fallecidas debido al coronavirus. De estos, durante el mes de julio se reportan 11 fallecimientos. En los últimos 7 días se han llevado a cabo un promedio de 500 pruebas diarias. Posiblemente llevemos a cabo las pruebas por parte del Distrito de Salud en su edificio ubicado en el 1702 de la calle Horn. Estamos planeando utilizar el centro Greenwood para ese efecto y serían los días martes, miércoles y jueves. Una vez concretado, le daremos esa información. Los lugares alternos que llevan a cabo la prueba, algunos son gratuitas y se requiere de cita. Esos lugares son con la Guardia Nacional, en el Centro de Exposiciones Richard Borchardt en Ciudad de Robestown, El número a llamar es el 512-883-2400. La Clínica Amistad al número 884-2242. La Fundación del Área de la Costa al número 356-9572. La Farmacia CVS ubicada en la calle Alameda al número 814-8305. Así como los centros Physicians Premier y Christus Prompt Urgent Care en cualquiera de sus locaciones.
Vulnerable population. The Health District continues to focus our attention on our most vulnerable population. It's important to mention that the vulnerable population is not only those over the age of 65. It also includes those that have diabetes, those that have high blood pressure, asthma, and even being overweight puts you into the vulnerable population category. Please pay close attention to what is currently happening in Nueces County. This is not the time to start visiting the most vulnerable population, nor to invite them to your home for any type of celebration where large groups or even small groups of people that have or may have practiced risky behaviors will be at. I believe our elderly and vulnerable populations trust their family members to keep them safe. So if you were inviting them over to a family gathering, they think it must be safe for me to be there. Why else would they have invited me? Unless you are certain that no one there is sick and no one has been out in large crowds practicing risky behavior, please do not invite them over to potentially expose them to COVID-19. COVID is real. COVID is dangerous. COVID kills. It is not something we should be playing Russian roulette with. This is not your typical virus. This virus is looking for a host and attacks some individuals a lot worse than others. These are our citizens and the lives of our loved ones we are dealing with now. These high numbers of positives are not from New York, nor are they from Washington State or from California. These are right here in Texas, and it's in Corpus Christi. Statistics show that the vulnerable populations are the ones that have the most fatalities. Nueces County COVID-19 hospitalized patients continues to rise, and today, as City Manager Zanoni mentioned, we have 285 COVID-19 patients. 88 of these are in the intensive care unit, fighting hard to recover. We must do everything in our power to protect our vulnerable population. It's up to us now on whether the behavior we practice is going to help spread the virus or is it going to help decrease the spread of the virus. This is a horrific virus that is in our community. We make and take risk every day. We need to decide right now, are there any risks worth taking that are more important than protecting the lives of our loved ones? Stay home, wash your hands often, clean commonly touched areas, social distance as far apart as you can, wear a mask when out in public, and don't touch your eyes, nose, and mouth with dirty hands. Whatever you decide to do, make good choices. CVS, our pharmacies, are also getting hit hard with having pharmacists that are becoming ill with COVID-19. The pharmacists have asked that we also ask the public not to send sick individuals to the pharmacy to pick up their prescriptions. Please send a healthy family member to pick up your prescriptions. Stay strong, stay protected, and as always, stay informed. Thank you.
El Distrito de Salud continúa enfocándose en la población más vulnerable, no solo a las personas mayores de 65 años, sino quienes cuentan con condiciones de salud como diabetes, presión arterial alta, asma y obesidad. Este no es el momento de comenzar a visitar a las personas vulnerables. Evite grupos de personas y así evitará la propagación del virus. A menos que esté seguro de que no hay nadie enfermo y que no haya salido de lugares donde hubo un gran número de personas, no arriesgue la salud de los demás. El COVID-19 no es un virus típico y puede atacar a unas personas más que a otras. Estas son nuestras vidas y las vidas de nuestros seres amados con los que estamos tratando ahora. Esto no es Nueva York, ni Washington o California. Estas cifras están sucediendo en Corpus Christi. Las estadísticas muestran que la población vulnerable es la que tiene mayor cantidad de muertes. Los pacientes hospitalizados con COVID-19 en el condado de Nueces continúan aumentando y hoy tenemos 285 pacientes con el virus. 88 de estos están en la unidad de cuidados intensivos luchando para recuperarse. Depende de nosotros ahora si los comportamientos que practicamos se agregarán a la intensidad de la propagación de este virus o si nuestros comportamientos van a ayudar a disminuir la propagación. Hacemos y tomamos riesgos todos los días. Quédese en casa, lávese las manos con frecuencia, limpie las áreas comúnmente tocadas. Practique el distanciamiento social. Use un cubrebocas cuando salga al público y no se toque los ojos, la nariz y la boca con las manos sucias. Y por favor, haga lo que decida hacer, pero tome buenas decisiones. Asimismo, los farmacéuticos de las farmacias CVS están pidiendo a los residentes de que cuando vaya a recoger cualquier tipo de medicamento que no mande a las personas que se encuentran enfermas, ya que muchos de estos farmacéuticos se han infectado también con el virus.
Hello, everyone. Barbara Canales, Nueces County Judge. Well, I'm working up to the last minute next door on conference calls so that we can be ready for testing this week, so that we can be prepared to stand up a COVID clinic as soon as possible. I've been working today with Amistad, and I want to say a heartfelt thank you to Dr. Jacqueline Phillips. Every once in a while in life, you get to meet people that you know are truly people who will change the world. And she's one of those people that's in our backyard. And she has been working tirelessly to create a set of guidelines and protocols to help establish a free COVID clinic such that doctors and medical practitioners and healthcare providers in our community could come and give their time voluntarily but basically walk into a clinic setting. But in order to logistically set that up, there are so many mousetraps, so to speak, to avoid. And so I hope to bring a white paper, if you will, so that you can really understand what we're talking about. But in its most rudimentary or basic level, we are seeing 388 cases today, a record. That means on average, 27 of those will get hospitalized if the laws of averages continue at this pace. 7% look like they were in hospitalization based on my math yesterday. But what's more important too is how do we make sure that number is its lowest? The way we can do that is by making sure that we're not overrunning our emergency rooms and our urgent care clinics, that people who have COVID get the medical care they need so they can stay as healthy as possible, and also really be educated as to the recovery process, because we know that COVID can affect you way beyond the 14 days. And so I really believe this clinic will help our community heal physically. It'll also help us mentally, knowing that there is a place to go. And again, there are so many details that are left to put together. But thanks to the Nueces County Medical Society and Dr. Stephan Walker, its incoming chair. Thank you to Krista Spahn, who said today that they would support this effort initiative. Through emergency management at the county, we are working hand in hand with these groups to see how we can help them provide all the structure that's necessary. In addition, regarding testing and getting some supplies, I know that there were STAR requests placed, and we are finally seeing confirmation in vivo, meaning in real life, of those testing supplies, but they're still not enough to do what we need to do. And so we have contracted with a private lab to help us, and I ask for all of you who we contact, who have been on the waiting list, to make certain that you're ready to get tested, because we might call you tomorrow and the test will be the next morning. So you've got to be ready to test. Remember, nothing is more important than your health. So getting a test is quick when we do it through our mobile drive-through testing, And we want to make certain we can get that for you and accomplished by the end of this week. And if need be, we're just going to keep on doing it until we make sure that that queue, that line, is completely down back to zero. We need to get back to status quo again and not have this backlog of people who need testing. I also want to say that the governor, and I was reading them, so I'm going to have to get back with you tomorrow with a full report, but it appears that the governor has issued some guidance, and TEA has as well, on schools reopening in the fall. And so I want to read it, digest it, summarize it, and get back to you tomorrow. But just know that there's going to be information brought to you tomorrow about schools and school reopenings. I want to re-emphasize something today. At my computer, I answered a lot of questions about gatherings. I want you to know that when we hit an all-time high of 388 cases and 8 deaths, you're going to have to question for yourselves whether or not it's a good idea to gather. You're going to have to say, something really is wrong here in my community. Our hospitals are almost at capacity. We're breaking our own records every day. And all the good work that you did over July 4th, it won't be seen for a while because we're still living off the sins of our past from the last 3 weeks. That's why you're seeing these cases going up and up and up. And so in order to we flatten the curve by raising the bar. I want to say that again. We're going to flatten the bar. Oh my goodness, Barbara. I'm tired. We're going to flatten the curve by raising the bar. We're raising the bar on our behavior. We're going to put it higher than we normally would. We're going to question everything that we're doing. And we're still going to be able to support our businesses, but we're going to be able to think before we act. Wear those masks, making sure that we're not oversending people to do errands where only one is required. Really think about these gatherings because we are very much at a critical state right now. And it's incredibly important that we ask you all to assist us at this time. Finally, I thought about this on the way over, and Gabby does such a great job of translating, but she will tell you, as I will tell you as a Spanish speaker, you never really translate exactly the same way because they're not your words, right? You're paraphrasing, and we do it the best. So, con permiso, Gaby, I'm going to deliver a different message in Spanish very quickly porque estoy tan preocupada. Estoy muy preocupada porque quiero que todo mi gente, toda la raza aquí de Corpus Christi, que cuídense. Ahora vimos 8 personas que fallecieron, 388 personas que acaban de estar diagnosticados con COVID-19, tantas personas en el hospital. Por favor, te estoy urgiendo, como la jueza del condado de Nueces, que por favor hagas todo lo que puedes para asegurar su familia seguro y sana. Esto te pido de mi corazón, porque sí estoy preocupada por todas nuestras personas que están aquí viviendo en el condado de Nueces. Olvídate de los picnics, de los barbecues, de las pachangas. Podemos hacerlos en otros días. Ahora necesito su ayuda. Te pido, te juro, por su mejoramiento y para su salud de toda su familia. Es por amor te digo esto, no solamente como juez, pero como vecina y una persona que ama tanto a esta comunidad y no quiero ver otro día como tuvimos hoy. Entonces es algo tan serio, tan importante que aquí te llamo y con permiso que yo no, inglés es mi primer idioma, pero yo quería decirte como nosotros hablamos en la calle, ¿verdad? Cuídense, toma este COVID-19 muy seria. Y con el favor de Dios sí vamos a recuperarnos, pero no solos. Él quiere que nosotros estamos juntos, luchando fuerte, y yo sé que con su apoyo nosotros podemos hacer todas las acciones correctas para reducir la transmisión de este virus. Bueno, eso es lo que quería decir. Viene de mi corazón y de mi alma. Y todas las pruebas que yo puedo hacer, no importa cuántas horas yo trabajo, yo no puedo reducir este virus si tú no me ayudes. Y por eso quiero hablarte en mi idioma favorita, segunda, español, porque esto es el idioma de nuestra comunidad, igual como inglés. Entonces te vemos mañana, a ver cómo vamos. Tal vez vamos un poquito mejor mañana, pero hoy es el día que tú dices, vamos juntos a atacar este virus. No nos vamos a dejar que agarra y que vamos a estar en esta situación que lleva 8 de nuestras personas. Y son nuestra gente, ¿eh? Este virus ataca a los latinos como grupo más que nadie. Entonces, que Dios te bendiga a todos y que estamos fuertes. Vamos adelante. Gracias. Just for my English-speaking audience, I just wanted you to know what I did was I was thinking about this coming over and wondering how I could really make an impact today. What more can I do? What more can I do? I've tried everything to make certain that we repeat all of the information that we know we've been repeating forever about hygiene and about testing, about the work that we're doing to try to help the hospitals, whether it's with resources or with clinics. But at the end of the day, I made an appeal to the Spanish-speaking audience, which I often feel gets left out, to be honest with you. As great as the translation is, we spend a lot of time talking, to the media, which is mainly English speaking here. And I wanted this message to be heard and carried to our Spanish-speaking audience here in our community, because we speak differently when we speak in that language. And I told everybody, forgive me, because Spanish is not my first language, but it is the language of my heart and my soul, and I want to appeal to everyone, and the appeal is that we must do everything we can to reduce the transmission, and we need to work together to change our ways so that we can do everything possible to limit our gatherings. And I want to thank you, and I'll stand by for questions afterwards. Thank you.
En resumen, he estado trabajando junto con la Clínica Amistad y le quiero agradecer su ayuda para poder establecer una clínica gratuita solo para los pacientes con el virus. Espero contar con esta clínica pronto. Hoy reportamos 388 personas diagnosticadas. El 7% de esos casos van a ser hospitalizados, por lo que hacemos lo posible por no poner más trabajo a los hospitales y ayudar a los residentes y que cuenten con otro lugar en donde recibir tratamiento. En cuanto a la realización de pruebas, vamos a recibir ayuda, pero también vamos a contratar a un laboratorio privado para llevar a cabo el análisis de esas pruebas. Si se encuentra usted en la lista de espera, le vamos a llamar pronto. También el día de mañana vamos a tener más información en cuanto a las escuelas y el próximo ciclo escolar. Más información va a provenir por parte del gobierno estatal. Con estas cifras tan altas en cuanto a los casos positivos y rompiendo récords, usted debe de preguntarse si es importante reunirse en multitudes. Le pido que utilice el cubrebocas y no acuda a lugares en grupos. Solamente que vaya la gente que es necesaria y no vaya gente de más a ningún otro lugar.
Okay, that concludes our briefing for today. I can take any questions that you might have. The judge is back out of this environment doing his Zoom, so.
What is the status on the medical personnel being sent out by the state?
the nurses and such. So the health director told me a little bit ago that we have a request in for another 20 nurses. So last week we had 2 requests in. I think there was a batch of 20 and then 30 or so. And a lot of those have been fulfilled or filled. But there is a new request out. The hospitals, as you can imagine, are at capacity, and the staff's working at capacity. But we need more. When you think about it, the COVID patient needs a lot more care. So one nurse can take care of, I don't know how many, but one nurse can take care of a lot of persons under general health issues, right? But a COVID patient takes a lot more care, so we need more nurses because there's more COVID patients. And but we do have a request in for 20 more from the state. But that is conditioned with everybody in the state is asking for more resources. So San Antonio, Austin, Dallas, and so on. So they were good in fulfilling our request last week, the hospital's request, I should say, and hopefully the same will happen this week. Any other questions? No, you guys are good? Okay, well, that concludes our briefing for today. Tomorrow is Wednesday, and we'll be here again tomorrow, the same lineup. Plan on Friday. Dr. Bird will be here Friday, and we'll be here Wednesday, Thursday, and then Friday as well with Dr. Bird. Thank you. You guys be safe and follow those guidelines that we've been telling you for many months. Thanks. Bye-bye.